Assalamu alaikum, this is Dr. Hasna and I welcome you back to another video. Happy subscriber week to all of you, and today I'm going to continue the discussion of lower limb muscles. I want to shift your focus to the board over here. We're talking about the leg muscles, alright? So in the leg we have three compartments just like we did in the thigh. So what were the thigh compartments again? Anterior, medial and posterior. This time we're just going to change up the medial into a lateral, because the medial compartment this time of the leg is basically superficial, because literally if I ask you to touch your medial compartment of the leg, you'll only feel bone. Therefore there's no space between the bone and the skin, so no muscle can literally be there. Okay, so we need space if we want muscles there. Okay, so what we're going to do is talk about the compartment in the form of three parts. In the three parts, just like the thigh, I want you to add these clinchers that you're gonna remember the action, the nerve supply and the muscles at all times. So first thing I already told you guys, and you should remember this, is that the anterior compartment is the extensor compartment in the lower limbs. So by default, this should be extensor compartment. And one more thing I want you to remember here, all the anterior compartment are going to be dorsiflexors. All right. Now let's talk about lateral compartment. The entire lateral compartment, or let's first talk about the posterior compartment. Posterior compartment, in contrast to the anterior, is going to be the flexor, obviously. So flexor compartment makes sense. But I want you to remember another word, that it does what? Dorsiflexion anterior compartment, therefore plantar flexion posterior compartment. Makes complete sense. There's no rocket science in this, all right? So plantar flexors. Now I want you to do lateral compartment is the only one left. All you have to do is lateral. So obviously lateral is going to push the foot this way. So it's going to be an everter compartment. So just write down everter. So all of these movements are going to occur distal to that area. Just like in thigh, it was occurring on knee. Therefore, in the leg, it's going to be happening on the foot. So dorsiflexors of the foot, everters of the foot, flexors of the foot, plantar flexor of the foot. There's no other mention of any other joint, all right? Knee joint has already been taken care of by the thigh. And above that, like God knows, we're going to discuss the leg for now. Let's not think about previous issues that we've had in our life, all right? So next thing I want you to remember is the nerve supply. Obviously, we start from our actions and then we go ahead and talk about the nerve supply. I want you to remember these very important characteristic nerves. In the anterior compartment, D for dorsiflexor. Therefore, why don't we just give a D nerve to these two? So it goes like deep peroneal nerve, all right? And if you want to remember, the anterior tibial artery is the artery of this compartment. Okay, lateral compartment, all of them are supplied by which nerve? They're going to be supplied by the anything peroneal is going to be the lateral compartment. Therefore, it's going to be the peroneal artery. No rocket science once again. And what about the nerve supply or peroneal artery? And I'm so sorry. And the nerve over here is going to be superficial peroneal nerve. Okay, because everything has to be peroneal. It's like literally the dress code of the lateral compartment. Now in posterior compartment, what we have left is the nerve supply of it is going to be the common peroneal nerve has two branches. One is the superficial, one is the deep supplied. What is left from the sciatic nerve? We got one nerve left that hasn't supplied anywhere yet, and that's the tibial nerve. That's right. If you knew this answer, you know lower limb well. So tibial nerve is what I want you to add over here. Tibial nerve plus what artery could it be? Obviously posterior tibial artery. I mean, this is no rocket science. So posterior tibial artery. Now you can see this overall image over here. You have revised your entire lower limb leg muscles, the most important gist of it. In the origin insertion, all you have to do is just go for one word, origin, one word insertion. And even if that's difficult, all you have to do is look at a picture. When you're learning origin insertions, look at the diagram. When you see the diagram, you have that picture memory, you can tell what the origin is. Oh, I remember this was arising from the fibula this way, and this was arising like this, so obviously it was touching the tibia, makes sense. So that's how you're going to do the origin insertion. Don't sweat on it, all right? So like, don't get worried about that. So now if I ask you, the extensor hallucis longus lies in which compartment of the leg? Instantly you should know, because of this diagram in your mind, is that anterior compartment. Therefore, what is its action? It is a dorsiflexor. Then what is its nerve supply? Obviously deep peroneal nerve. Now, since if there's any nerve, if there's any injury to the dorsiflexor compartment, for instance, some friend of yours gets just really jealous of you that you have such a good prep in lower limb, and they come and like they hit you, they hit you so hard that your dorsiflexors break. What do you think is going to happen? This is an important clinical. It is known as foot drop, because this is dorsiflexion. If this is not taking place, so obviously foot drop. So in upper limb, it was radial nerve causing wrist drop. In lower limb, there is the deep peroneal nerve causing foot drop. All right. So If I ask you what compartment does the flexor hallucis longus lie in? Posterior compartment. It's a flexor compartment by default. Just remember one more thing, the posterior compartment is just going to be divided into superficial muscles, deep muscle, and the deepest muscle. The deepest is going to be tibialis, superficial muscles are going to be gastrosoleus, and between those two are all the flexor muscles. Now I want you to, another question that comes in the ankle joint is, then what are the inverters? You've talked about everter, okay, dorsiflexor, plantar flexor, just one possible movement left, which is inversion. So what about that? All you're going to do is with the inverters, you will just write down the word tibialis. Anything that starts with tibialis is going to invert. So now you know the actions on your fingertips. You are going to be able to solve MCQs this way. So guys, I have a full recorded session of my lower limb revision and summarization. The link is in the description if you want to know more about that. And apart from that, happy subscriber week to all of you. In the next video, I'll discuss the foot muscles.